My name is Lester Mascarenhas. I work as a GP in refugee health. I became an S100 prescriber in 2016. Prior to the S100 program, if someone had hepatitis B, they would have to see a specialist. But the S100 program allows GPs to prescribe this medication.
Hepatitis B is a chronic viral infection that infects the liver. We know that there are about 250,000 people in Australia living with chronic hepatitis B, the majority of whom have come from overseas, and unfortunately up to 40% of those people in Australia have not been diagnosed.
The model of hepatitis B care, which is essentially regular clinical review and blood tests, plus in some patients the need to initiate treatment and then to monitor the efficacy of that treatment, is really no different to any other chronic disease management. And that's why it lends itself so well to primary care and so well to being run by GPs.
So the S100 program is really beneficial for our patients. It means that they can access care locally. And this is really important, especially when you're dealing with migrants. They might find it difficult to travel to other parts of the city to attend specialist appointments. They're comfortable with their GP, and it makes a really big difference in them accessing treatment fast, so they're not waiting months, sometimes even a year before a specialist appointment.
I'm Sydney. I have lived in Australia for more than 10 years and I'm living with hepatitis B. I think it would be easier to go to see a GP to manage my hepatitis B because it's only one process, and also it's cheaper than a specialist.
We understand our patients within the context of their lives. That's what's so special about general practice. And it means that we're managing their whole health care. We can manage their blood pressure and high cholesterol or diabetes, as well as their chronic hepatitis B.
Once a GP has done their Section 100 training through the VITAL program, they're then supported to continue in professional development activities. We run case discussions if that's of interest for GPs. We obviously have the ongoing mentorship, and we have a range of mentors that are available who practice all over the state.
There's a community of GPs and specialists out there. They meet frequently, so several times a year. And yes, it does feel like a special group.
We're treating less than a third of the people in Australia who we estimate to need treatment for hepatitis B, so we need to be doing a lot better. And the answer doesn't lie in more specialists or more hospital clinics. The answer lies in integrated care in the community.